My name is Katy Fisher and I am a health visitor based at Kidbrooke Health Centre. Today I'll be talking to State Director Rachel Evans about lone working at Oxleas. Can you explain exactly what a lone worker is?
Certainly. A lone worker is someone who works either regularly or occasionally on their own, so when they're without either direct supervision or access to colleagues, then they're considered to be a lone worker. And we'd probably commonly think of people visiting patients in their own homes as being lone workers, and that is true, that is a situation that you'd consider lone working, but it would also apply maybe in community clinics if people are isolated, or even in parts of a ward. So if you're out of earshot or sight of colleagues, then you should consider yourself a lone worker.
Why is it important to be aware of lone working?
People need to think about lone working because it may increase the risk to themselves in terms of their safety or security. So they really need to assess those risks and make sure they put in place control measures or precautions that will help to reduce that risk. There's lots of information available on the intranet to give people advice on how to do that, and I would recommend that people look at that and familiarise themselves with it. We have a trust health and safety team who are exceptionally knowledgeable and skillful and very friendly as well, and they're always willing to come out and talk to teams about how to put precautions in place to ensure their safety when they are lone working.
For many of us, working alone at times is unavoidable. How can we minimise risk?
What each team needs to do, led by the manager but with input from the team, is undertake a risk assessment of lone working so they know what the risks are that they're facing and what mitigations they can put in place. And from that, each team should develop a safe system of work. That will vary according to the team because each team's needs are different, but as I said earlier, there's lots of information on the intranet that will help people to put together a safe system of work that works for them as individual teams. Staff should ensure that they're familiar with the safe system of work that's been developed for their team, and if any member of staff doesn't know what that contains, they really should talk to their manager to ensure that it's clear. In order to minimise the risks themselves, they need to be following the advice in that documentation, so they need to understand it, and importantly, they need to follow it.
What will this safe system of work contain?
It will give information for staff on how they should plan a visit and how they should undertake a visit. So, for example, before a visit to a community setting, one would expect a member of staff to be checking the patient record to see what the risks might be. That might be in relation to the individual patient, their family or the environment. And having identified those risks, they should then consider what precautions they should take to minimise those when they're out on the visit alone. It's really important that people take the necessary precautions to make sure that they are safe. And in some circumstances that might mean that a member of staff with their manager decides not to enter that lone working situation and, for instance, not visit a patient alone but maybe go with another member of staff. The safe system of work will include a process for ensuring that staff stay in touch with colleagues or managers, and part of that will be having some sort of emergency protocol so that if they're in a situation they're uncomfortable with, they have a way of raising the alert with other members of staff, with a manager. So that might be a coded response through a telephone call, or for some members of staff they may be issued with some sort of device that will help them in that situation. As an organisation, and to raise the profile of lone working, we're proposing to purchase personal safety alarms for all members of staff. So this will be the screech type alarms that when they sound are uncomfortable and very loud. And it's intended to be a mechanism for just reminding people and to give them an added safety precaution that they can use when they're out working. If you do find yourself in a lone working situation, you should be continually assessing the risks, and if there is anything that's causing you any concern, then the advice is to withdraw from the situation.
Are there any other steps that should be taken?
Staff should always complete the personal safety training that's relevant for their role, so that might be conflict resolution training or breakaway training. In addition, after a visit, they should always record on the patient record any concerns that they've had during the visit, so that if they return or if another member of staff visits that same patient, that they have that information to hand. And finally, they should record everything on Rio, even if it seems very minor. because that's the way as an organisation that we learn, and colleagues should benefit from that learning.
What should we do if we feel at risk?
Staff should never put themselves at risk. The Trust don't expect staff to be putting themselves in risky situations, and if you do find yourself in a situation that you're unhappy with, you should leave immediately. The safety of staff is paramount.
Thank you so much for coming today, Rachel. It's been lovely to have you and talk about learn working policy.
Thanks very much, Katie.
Thank you.